Now to the fight against the coronavirus. Connecticut is a leader right now. The percentage of people testing positive here is under 2%, which surprises some who feared an increase, especially after the casinos and some other businesses started reopening a few weeks ago. Channel 3 Eyewitness News reporter Matthew Campbell is looking into the science behind all of this. He's live right now with more of what he's found out for us. Matthew?
Yeah, Mark, this is a question that so many people have asked online. They see photos like this one from Walnut Beach a couple of weekends ago. Then they see our numbers are some of the best in the nation, and to them it just doesn't add up. So we asked the governor and a health policy doctor to explain.
According to covidexitstrategy.org, Connecticut is one of 7 states exceeding expectations in the fight against coronavirus. The 14-day trend of positive cases is down by more than a half. Testing is soaring. There's adequate hospital space, but most importantly, the percentage of people testing positive remains low.
We're down about 1%.
I think we went from being a hotspot to being a national leader on these issues.
All encouraging words coming from Connecticut at a time when in just the last 23 days, we've seen protesters stand shoulder to shoulder while gamblers from across the Northeast flocked to Mohegan Sun and Foxwoods. We wanted to know why the health consequences many experts expected hasn't materialized.
I think what we're finding is wearing of the mask is probably the biggest determinant in terms of what you see in terms of the infection rate.
Dr. Summer McGee, the Dean of Health Sciences at the University of New Haven, agrees.
Right now. So it's much harder to have community spread because so many people for so long did such a good job of staying home and not going out in public. And then now that they're following these public health measures like wearing masks.
She also points to the methodical way we've reopened. Connecticut is working with a 30-day buffer between phases of reopening.
We need at least 3 or 4 weeks to see if the actions we've taken around reopening are going to have an impact.
Several southern states opened months ago, spacing their phases out by weeks and in some cases days. Dr. McGee says the numbers show they're now paying the price. Infection rates in states like Florida are exceeding 10% of those tested.
They didn't take the time to really ensure that what they had done in that earlier phase wasn't going to result in a spike in cases.
It's resulting in Governor Lamont considering a 14-day quarantine for those arriving from hard-hit states. After making positive strides, experts don't want to lose that momentum.
We can't be in a race. We've got to take our time and be in this for the long haul. And if we continue to do that here in Connecticut, I think we're going to have a much more successful fall and hopefully be able to keep our economy open.
Now, overall, as a state, we appear to be doing well, but we may be seeing a flare-up of sorts in southeastern Connecticut. The latest numbers from the state show Montville, which is home to Mohegan Sun, has 291 positive cases. And when you look at the case rate per 100,000, that's on par with a city like New Britain. Live at the digital desk, Matthew Campbell, Channel 3 News.